We are having a very special lecture today. This is a dear friend of mine, Rick Lassiter. He is a counselor as well as a personal wellness coach, and I've met him from working at other universities. So if we can have a nice warm Wildcat welcome for Rick.
Okay. So I'm being told that you have an exam after this class? Wow. So how are you feeling about that right now? On like a scale of 1 to 10, 10 being over the top? How many are about a 10? 5? 10 plus? 10 plus, okay. So hopefully some of the information that I shared today will help get you down to around a 2 or a 3. I can't promise, but I'll do my best. So everybody here wants to be a nurse? So I'm at the right, this is the right room then. Okay, just double checking. So I met Vanjie at another university, and what we're going to be talking about are wellness strategies for the rest of your life. I'm a child and family therapist. I work here in Tucson, and being a therapist, I'm considered a helper. And you're getting ready to go into becoming nurses, so you're also in a helping profession. And one of the main things that I focus on is helping the helper, how you can maintain your balance and be grounded as you go and you give to others. Because the old saying is, it's hard to give from an empty well. So that's pretty much what we're going to talk about, and we're going to encompass different modalities, and I'll give you some things that you can use yourself before your test, and also when you're out there in the field, a couple of things that you can share with your clients, because they will be looking to you as the expert when you go out there and get into the field. My grandmother called me and said my mother passed away, and that just kind of shook my foundation of what was going on in my life. So being a war veteran, I started having a lot of these symptoms that were going on inside. So I made an appointment to go to the VA, and there was a doctor there, and I said, "Doc, you know, I'm pretty healthy, but all of these things are going on inside my body. You know, I got heart palpitations. You know, I feel like I'm not grounded, like I'm leaving my body. I'm waking up at night." So he looks at me, and he said, "Well, how long were you over there?" I said, "I was over there for 6 months. You know, I'm on the registry, so they know if anything happens, I'm signed up with the Gulf War Registry." He said, "Well, you know," he said, I can give you some medicine, and, you know, make you feel better. And I said, "Well, how long do I have to take it?" He said, "Well, who cares as long as you feel good." So I had to debate, because he already had about 4 prescriptions he was going to give me. And I said to myself, I said, "Well, let me think about it." So this is, you know, there's true stories and there's real stories. This is a real true story. So over the loudspeaker, I hear, "Paging Dr. Smith, paging Dr. Smith." And that really doesn't happen, right? So I'm looking at these coincidences. So he leaves, and right behind him on his wall, it says 10 things that cause stress and anxiety. And death of a loved one. I just bought a new house. I had 3 little kids, 6, 2, and 3 at the time. Changing careers. I used to smoke cigarettes, drink excessive amounts of caffeine, you know, and when you're a student, you're in a lot of stress too. And that's what really, I said to myself, he came back, I said, "Well, you know what, let me see if I can try to do this on my own," you know. So it was during that time that I started to educate myself and become aware of some things that I can do that will help me stay balanced and move forward. And one of the things that when you go out there in your field is that you are the prime example. People are going to look towards you. And if you're grounded in your foundations and you're not in survival mode, but you're moving forward, then it puts the whole community that you work in at ease. And it becomes like I don't know this operative word, an infection. It just spreads. And then, you know, you're that light that people gravitate towards and want to learn from. See, the thing is, you already have the scores there. Don't look at that. Okay, so everybody has a copy, correct? All right, so just follow along as I read aloud. This is a distress symptom scale. Complete the following inventory of your current distress signals. While some of these items may reflect positive stress, for example, talking faster than usual or difficulty falling asleep, the scale as a whole is intended to measure distress. It correlates highly with the number of other stress-related scales, suggesting that it is a valid measure of distress symptoms. The most important thing for you is that it will give you a fairly vivid picture of what you are experiencing in mind, body, and behavior. Some more education. In order to get yourself back into balance, you have to be aware of your domains of wellness. So we have 1, 2, 3, 4, 5, 6, 7, 8. The personal challenges you have going into the helping profession. There's a term that we have in counseling, it's called countertransference. Okay? This is where being in this field, I've seen this in my practice. I've seen this with anyone that's in an agency, anyone that's helping other people. This right here is something you want to really focus on. And since you're just starting out, you have a lot of time to do this. Countertransference is when your own needs or unresolved personal conflicts impede your judgment to facilitate the best available treatment for the client. So I want to leave you with 3 quotes that I found to think about. 2 are by Khalil Gibran Khalil, and 1's by Ralph Waldo Emerson. The appearance of things change according to the emotions, and thus we see magic and beauty in them, while the magic and beauty are really in ourselves. What lies behind us and what lies before us are tiny matters compared to what lies within us. You give but little when you give of your possessions. It is when you give of yourself that you truly give. And it was a pleasure to be here today, working with you givers and healers, and please keep up the good work. Thank you.